Of course, the annual event here is known as a party with a purpose, and certainly one of the causes we want to look at right now is maternal health care across America.
That's right. As states begin to impose abortion bans and the maternal death rates continue to rise, there are many questions now surrounding the future of women's reproductive care and the safety of pregnant mothers even after delivery. And here to help us break all of this information down is the medical director of Quality Women's Services here at Osner Health OBGYN. Dr. Veronica Gillispie-Bell. Dr. Gillispie-Bell, thank you for being with us, and thanks for being here in New Orleans with us. This is a sobering fact. Among developed nations, the United States has the highest maternal mortality rate. With Roe v. Wade being overturned, what are your biggest concerns surrounding what's already an abysmal number to have?
Yes, first of all, thank you for having me here. As you mentioned, we are a country that spends more than 17% of our gross domestic product on health care, but yet we have the worst outcomes. We do know that some of those things that are leading to those outcomes are making sure that we have readiness in the hospital, that we're preparing for the leading causes of maternal death and those causes that are related to the pregnancy. And we are now considering the new landscape and how we manage different conditions.
And we talk about mortality rates. We know black women certainly, almost in any category are disproportionately impacted, but what are some of your numbers in your review showing you? This is kind of, I've seen some of it, a little scary to hear with the results of what you're seeing.
It is scary to see. We know that 3 to 4 black women die at a rate of every 1 white woman. And we know that even when we adjust for socioeconomic differences, we still see those disparities. And what I mean is that we know that a black woman with a college degree is twice as likely to experience a severe maternal morbidity compared to a white woman with an 8th grade education.
Wow. Yeah, and Veronica, you and I are both OBGYNs. We know, as we've been talking about, just how bad the crisis in maternal health is in this country and reproductive health. You're really pioneering a kind of this interest in the so-called 4th trimester after pregnancy, because so much of our healthcare shifts from the woman, whatever level it is, to the baby after delivery. And the 4th trimester, the period after birth and delivery, is really when a lot of the disasters happen. So tell us a little bit about that nationwide and what you're trying to do here in Louisiana.
Yes, you're so right about that. It's really unfortunate that as moms are delivered, they become disconnected to the healthcare system, really, until we see them for the arbitrary 6-week appointment. We know from looking at our numbers that the majority of deaths actually happen after delivery. And so we are working on ways through Ochsner to keep connected with those moms in the postpartum period and really using ways to bring care to the mom instead of making mom come to the care. We've developed a healthcare system around the healthcare system and not around the patient. So by using telehealth as one of our tools, we're making sure that moms are able to stay in the comfort of their own home, and we're able to still connect with them, connecting for mood checks, connecting for blood pressure checks, especially for those women that have hypertensive disorders of pregnancy. We know that time after delivery, they are at an increased risk for stroke and having some of those ill outcomes.
And what about, the focus on prevention of heart disease? The 3 of us talk about that all the time, the #1 killer of women. And as OBGYNs, we're oftentimes the only doctor that a woman sees throughout the course of her lifetime.
That is so true. And again, making sure we're controlling those blood pressures in the postpartum period, but also understanding, as you mentioned, for women that have a hypertensive disorder of pregnancy, they have a lifetime risk of stroke that's increased, a lifetime risk of cardiovascular disease. And so it's really important. We tend in medicine to think about swimming in our own lanes, but we need to be a family and a team for our patients. And so making sure that we're connecting our moms to cardiologists so that we can monitor their cardiovascular health.
Well, Dr. Gillispie-Bell, thank you so much for spending some time. Again, party with a purpose, and this is always worth talking about day in, day out, but I'm glad we're focusing on it here as well. Thanks for spending some time with us.
Thank you. My pleasure.
Yeah, thanks for being here.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.